Welcome to Season 4 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Josh Sharfstein, Vice Dean for Public Health Practice and Community Engagement and a former Commissioner of Health in Baltimore City. Our goal is to bring scientific evidence and experience to current topics in public health through engaging interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hey, Public Health on Call listeners. You're invited to join us virtually on Wednesday, November 10th for the 2021 Bloomberg American Health Summit. This year's theme, Public Health Visible. You'll hear from great speakers and take in provocative discussions about major challenges facing health in the United States, including COVID, overdose, violence, climate, health problems facing immigrant children, and the broken food system. You can join the live stream at 9:30 a.m. Eastern Time on November 10th. Learn more at americanhealth.jhu.edu. That's americanhealth.jhu.edu. Hi, I'm Lindsay Smith Rogers, producer of Public Health on Call. What happens when education and health come together to help kids succeed in school? In Washington, D.C., an innovative program shares absenteeism data with pediatricians. The result? More students returning to the classroom. Today, Andrea K. McDaniels talks to two leaders at Children's National Medical Center involved in this effort. Danielle Dooley, a general pediatrician and medical director of community affairs, and Tanya Vidal-Kinlow, Vice President of Community Engagement, Advocacy, and Government Affairs. Let's listen.
I'm Andrea McDaniels, Director of Communications for the Bloomberg American Health Initiative. This special podcast is about the Chronic Absenteeism Reduction Effort Program, or CARE, in Washington, D.C., a program that aims to connect doctors to schools to address chronic absenteeism. Dr. Danielle Dooley and Tanya Vidal-Kinlow, thanks for joining me. We're going to start off with you, Tanya. Can you talk a little bit about what was going on with absenteeism at Washington, D.C. schools before you all got involved? Why did we put doctors in schools? What was going on?
So thank you so much for that question. Of course, Washington, D.C. was experiencing pretty significant absenteeism across all grade levels. We at Children's National recognize that if a child is not in school, then they're missing out on important opportunities. And so we looked at what we were seeing and felt like we needed to find a way to engage and provide supports where we could, and thought that finding a way to link where the absenteeism was related to a health matter to support the schools and doing everything we could to get that child ready to learn.
And so you touched a little bit on how missing school hurts children. Can you talk a little more specifically, Tanya, about how missing school hurts children and their potential for a successful future?
Yeah, so of course, if you're not there, then you're definitely missing, as I said earlier, an opportunity to learn. And that's what school is all about. If you think about the space that children spend the most amount of time in, the first place is obviously with their families. The second place is in their schools. And those schools are where we send them so that they can develop both academically, socially, emotionally. And if they are not in the schools, then they are missing out in all three of those areas. And my colleague, Danielle Dooley, who is a pediatrician and sees children every day, will tell you that that engagement and interaction is so critical to a child's growth and development and for their success in life in the future. And so for us, it's spectacularly important for us to be able to engage in whatever activities we can do to make sure that a child is in school. So not only is Children's National involved, through our general practices and our primary care centers, working with doctors like Danielle, but we also support the school district with our school nurse program so that if a child starts to feel ill while they're at school, they can see a healthcare provider. And if there's nothing serious, we can get them back in school. We also support DC Public Schools through the school health suites in some of our high schools, where I think we have some of our largest areas of school absenteeism and where it is ever more critical for students to be in the classroom learning and preparing for that next stage of life, either college or career. And so we are in those schools making it easy for youth to access services as well. Again, like, let's not miss school because you got to go to a doctor's appointment. You have a doctor right in your school. Let's not miss school because you're not quite feeling well. Let's get you in, get you seen. If you're okay, back to school.
Thank you. Thank you, Tanya. And Dr. Dooley, excuse me, getting tongue-tied here. Can we talk, let's get to the nuts and bolts of the CARE program. Can you talk about how it works? Or how does the school system connect you with children?
So the chronic absenteeism reduction effort at its core is supporting student attendance. And we do that in this way through a unique initiative where we work to share student attendance data with pediatric practices. So parents in a group of schools can sign a consent form to share their students' attendance data with their pediatric provider, and it is matched and sent to that pediatric provider's practice through our Regional Health Information Exchange, which is called CRISP, or the Chesapeake Regional Information System for our patients. And so that's where we already have ED and hospitalization data on all of our patients. And in that, we're adding on that layer of school attendance data for students whose parents have consented for that data sharing. And our practice receives that data drop once a month. And then we contact families who've had a student who's been absent, and we offer outreach and support and help determine if there's issues we can assist with to help that student return to school.
So you're essentially using electronic medical records, which have become more popular in recent years?
The data doesn't go into our electronic medical records, but we're using a Regional Health Information Exchange, which stores a lot of hospitalization and ED data already on patients. And then that is sent to us once a month via a secure spreadsheet and a secure email messaging system.
And so how important did data, you're talking about all this data, how important does data play a role in helping these kids?
Well, the data here is really critical because one of the gaps we identified is that many pediatric providers don't actually know when their patients are missing school. So unless that student is in front of me in my office that day, or I receive a call from the parent requesting assistance with something, I actually have no idea if a student has gone to school that day or has stayed home. You know, there may be a minor illness, there may be a social issue such as lack of access to transportation or lack of access to childcare for younger siblings that's preventing a student from going to school, but I don't necessarily know about it. So getting that data every month has really allowed us to take a more holistic view of our patients and look at where their education, which is an important determinant of their lifelong health and economic outcomes, where their education is being impacted because they may not be able to attend school, and then how we can support that student and their family.
And Tanya, why are health systems and schools natural collaborators?
Health systems and schools are natural collaborators because when we look at what it takes to create a healthy child, a child that has a well-balanced lifestyle, we know that the excellent clinical care that we can provide through our doctors at Children's National represents really only about 20% of, the health and wellness and lifestyle. The other 80% is related to other social factors like education. And for children, education, I think, is the most important of those social determinant indicators. Others are housing and food security and transportation, things that really the child is not directly engaged in one way or the other. So education is obviously a critically important social determinant of health, and why it's important for schools and health systems to collaborate. When you think about the fact that a child who goes to college has a longer life expectancy, if you're not in school, if you're not there to learn, you're likely not going to get to or through college. And so we've got to interrupt a cycle of absenteeism as soon as possible.
And were parents willing to sign on, or did you have to convince them? Did they get what you were trying to do? Danielle.
With very little promotion, we've actually had a really good uptake among parents of signing student consent. Obviously, the pandemic has limited our ability to engage directly with families, and so we're reinvigorating our efforts. But initially, about half the students in the group of pilot schools were consented to participate in the data sharing program. And I think it's important to note that before we rolled this out, we actually did a lot of community engagement. So we conducted focus groups with both pediatric practice team members, but also, and most importantly, with families in the community in which we were going to be working to get their feedback around the acceptability of sharing this kind of data and how they might perceive it and how it could be helpful, and also what concerns they might have around the data sharing. So we didn't just roll this out without involving our community in a very direct way from the very beginning to get their feedback.
In essence, you got the buy-in ahead of time.
Correct.
It sounds like a wise move. Get them on board so they know what's coming at them. Definitely. Can you talk about the types of health problems you were seeing, Danielle? What were some of the common health problems you were seeing that were keeping kids out of school?
So certainly, I think two of the biggest issues were uncontrolled asthma. So asthma where a student might have been hospitalized or had an emergency department visit and needed follow-up really quickly with their primary care pediatrician in order to get additional medication or check to make sure they were well enough to go back to school after an emergency room visit or hospitalization. The second would be around mental health. We're very fortunate at Children's National. We have the Whole Bear Care program, which incorporates psychologists into our primary care clinical teams. And so we have psychologists embedded in our health centers with us who we work closely with. And so when we were able to identify a mental health issue, either amongst the student or the parent that was preventing a child from going to school, we were able to link that family with resources immediately to help address that. And then we rolled out our program for the first year during the pandemic. And so the other major challenge was in assisting families with navigating virtual learning. So helping families access a device or accessing the online curriculum for their student so that they could get access to their education while they were in remote learning was also something that our health center and outreach team assisted with.
So you were able to help kids in other ways as well, it sounds like.
Definitely.
And either Tanya or Danielle, can you talk about some real life success stories? You don't necessarily have to give names, but was there a kid who had missed 30 days and now he's, in school almost every day? Any particular stories either of you can talk about?
Well, we had one parent whose child actually in the past had missed so much school that the parent had been referred to the court system because the child had exceeded the maximum number of days missed in school. And while that child was now back in school, when they had subsequent absences, the parent shared with our outreach team that she really wished this program had been around in the prior years when her child was really struggling with school attendance, because it would have avoided involvement in the court system and we could have helped identify much sooner supports that she needed for her child to attend school. We also had another child who had missed school due to a hospitalization for COVID and asthma. And we were able to connect with that family really quickly, get them all of the medications and paperwork they needed to return to school. And then subsequently, that student was not back on the absence list for the rest of the school year.
And Tanya, so can you talk a little bit about why these kids aren't getting the care? I mean, we know it's not that the parents don't care about their children. So what happens that, they're not getting the care that's keeping them out of school?
I don't know that they're not necessarily getting the care. I think that there could be a lot of reasons why, a child is missing school, and missing school could be related to a health matter that a parent might not think it's necessary to bring them into the pediatrician's office on that given day. Or there could be other challenges to making that visit. When we do have the access to information from the schools, it helps us to do kind of the real-time outreach and engagement that Danielle mentioned with families who are part of our medical care system, and to, see if there's anything we can do to help support that family and get that child back into the classroom.
That's great. That's great. And then your program has done so well, it's expanded. You want to talk a little bit, Tanya, about how Delaware is now modeling the care program there?
I think I'm going to tee that off to Danielle. She's been working closely with our colleagues, and she has that firsthand info. Danielle?
Sure. So we feel really fortunate. The Bloomberg American Health Initiative really provided the seed funding to catalyze and start this program. And then the United Health Foundation has provided us with the subsequent additional 3 years of funding that's allowing us to expand to 8 more schools in Washington, D.C. And at the same time that we've been doing this work, we've always been in close contact with our colleagues in other states who are interested in doing a similar data exchange. And so Delaware and the Nemours Health System in Delaware was able to implement a similar data exchange that they have just started this fall, the small group of schools and their health system. So it's really exciting to see other states and other programs recognizing the importance of all of the sectors working together to keep children in school.
Because I'm sure every state has some children that are probably facing the same types of absenteeism problems, for sure.
Yeah, I would say absenteeism is not obviously exclusive to the District of Columbia or even to urban areas. It is a challenge across the country. And wherever we can create a model that can be replicated, we're always excited to be able to lead in that kind of space. And tackling an issue of absenteeism is not something that you would think a hospital or a health system would naturally do, but it was something that we saw as an important issue in the District of Columbia. And, we felt like we had some creative ways of addressing it. And so working to support that, I think, has been really great outcomes for us.
And so, Tanya, to kind of wrap it up, what do you see for the future of the program? What do you want to see next?
We definitely would like to see it grow into more schools system-wide, to actually be able to have greater collaboration between our schools and the health systems, possibly bringing in other community partners to help support this work. Because if we start to see the kind of results that we think we're going to see, kids in school more often, then they have greater academic success, then we want to definitely expand it to touch as many children in the District of Columbia as we possibly can.
How about you, Danielle? Is anything you want to see for the future of the program?
I think we also really want to see school attendance as a vital sign in pediatric practice. So just like I'm checking on how a child might be growing or what their blood pressure is, I think it's really important for pediatric providers to also know how successfully those kids are able to attend school and what might be some of the barriers to school attendance. So I think to have school attendance as a vital sign in pediatric practice would be a really amazing outcome of this process, along with normalizing for students and families and pediatric providers discussions around school attendance and ways that our pediatric practices and health systems can support school attendance.
Great. Well, this is a wonderful program that you guys have. It sounds like you're helping a lot of students and aiming to help even more. So kudos to you all. And thank you for being on our podcast today. It was wonderful talking to you. Great conversation.
Thank you.
Thank you so much.
Public Health on Call is produced by Josh Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by Spencer Greer, Niall Owen McCusker, and Matthew Martin with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media support from Grace Holes Fernandez and Caroline Wong. Thank you for listening.